Hi, this is Dr. Mark Santa, and welcome to this episode of Level Up. Level Up's a podcast that brings you the ideas, strategies, and the people to help bring your practice up to the next level. Today, I'm really happy to be with Dr. Jason Dunlap. Jason is a chiropractor who has absolutely transformed his practice using Shockwave. And many of you, I'm sure, have heard about Shockwave. There's Shockwave and then there's Shockwave. And Jason's going to teach us about that. So welcome, Jason. Thanks so much for being with us.
Thank you so much for having me. I'm really excited to be here today.
So, Jason, you are a chiropractor. You are a second career chiropractor, right? So you came to chiropractic a little bit later than most folks.
Yes, I was a head football coach, educator, taught, was certified in multiple subjects. I think history, PE, special education, coaching football, track, weightlifting. I had a lot of athletes that were injured, having surgeries, finding empty pill bottles laying around the locker room, knew that there was something else that could be done. When I started sending my kids to the local chiropractors, they were getting back on the field quicker. And it just seemed to link up, was able to get in with a local chiropractor. He became my mentor.
Love it.
And kind of just went from there. I was lucky because Palmer, Florida was really close to me. I did not have to move to go to school. It was about 25 minutes from me. So I was able to go to Palmer, Florida, and it was wonderful. Such a great career move for me. I love it. Love it every day.
I'm so glad. They're doing really great work at that school, by the way.
Yes.
So OmniWave is the sort of the next evolution of Shockwave. And let's imagine that the folks who are listening don't know anything about Shockwave. Give us a little bit of the history, the evolution of how this
Okay.
developed.
So you have a guy named Yukin in the 50s who actually he patented Shockwave for kidney stone disintegration.
Okay.
It wasn't until about 9 years later where a guy named Goldberg actually performed the first lithotripsy with electrohydraulic. Okay, and that's very important. So they would actually submerge the patient in water and to perform the lithotripsy to break up the kidney stones. So electrohydraulic is actually the purest form of Shockwave. Okay, so you look at the new OmniWave that has just come out, and that is electrohydraulic, and that's why we're so excited about it.
Got it.
But it wasn't until about the 60s or 70s that they accidentally discovered the effects on human tissues,
Mhm.
that it could, do a little bit more than lithotripsy. And then it wasn't until I think it was 93 that Lowe and I think Jurgowski's, they started doing Shockwave on calcified tendons in the
Mhm.
shoulder. And then that's when it really took off for musculoskeletal. So that's really exciting stuff, and it's come a long way since then. You have we'll talk about this, but the radial, and then on to the early stores and the early Chattanooga machines, onto piezoelectric, onto what we have today with the OmniWave.
So pause on that for just a sec because we used a couple of terms there that many people might they just think shockwave is shockwave, right? And that's
Correct.
what they've been exposed to. But there's a quite a difference between a radial acoustic device and a focused acoustic device. Talk a little bit about what that means.
And that seems to be the biggest holdup, when people are so confused with the two, and I think that kind of doesn't really kind of scare them away because they aren't sure what to do, which one to get. So the earlier ones were radial, and they still have radial, and radial is still wonderful. There's still uses for it. It's kind of like ripples in a pond. It's more superficial, skin deep, fascial trigger point.
Mhm.
Um, it's kind of like a grenade, whereas the focused is more of like a heat-seeking missile. Now, again, I use radial, love radial, but it's the newest, and the I guess the better of the two is the focus that is coming out,
And
and has been out for a while.
and so the mechanism of action in a radial is like a bearing or a kind of a BB or whatever in the head that creates this shock wave, right?
Yes.
And that there's no BB or bearing inside the focus device, right?
Correct. So like radios is actually high speed sound waves.
Okay.
So they're pulsed out and it's not really true shockwave, if you will,
Mhm.
but the focused and especially the electrohydraulic is true. And it's all about the charge and how the actual the pulse that comes out of the machine when it's applied to the skin and you're doing the treatment. Now again, radial is good, but we've increased the technology, and as we're talking right now, it seems like the new kid on the block and the best is the OmniWave,
Yeah.
which is true electrohydraulic, and it's brand new to the market. And the coolest thing is it's made in the US, where most of these machines are German made or made across the United States. So
Yeah.
that's really exciting.
I like that. Made in the good old USA. So focused implies to me anyway that it's more precise, less
Correct.
diverse, and I believe because of that, there's a greater depth of penetration. So you can actually treat conditions with a focus shock wave that the radial would not reach the depth of penetration to be able to be effective.
100% correct. I also use it, especially on the first visit. I use it as a diagnostic tool also. So the patient will say, I have pain here. They'll point somewhere. So
Yep.
as I'm going over, I will let them, and it's a give and take. They have to give me feedback. And as I'm going over a spot, and I kind of start either superior or inferior or around the area. And
Yep.
as we go over the spot, I give them, they're like, it's a 1 out of 10, it's a 2, it's a 3, it's a 7, and then I will stop at the highest. I will
Yep.
put out a skin marking pencil. I will mark that spot. I'll take a picture of that area, put it in my notes, and then we will continue to treat that. So I will put it back on that spot and I will say, okay, it's a 7 now. Let me know when it decreases. It'll go 6. Okay, now it's a 5. Wow, it's a 2. It's a 3. Okay, now I don't feel it. And then we'll move on, and we move it very slow around that area until we take care of all the inflammation in that area. And then next time they come in, I have them point, where is the pain again? Okay. And then I look at my notes. Has it moved? So you're able to, so the first time it's such a great diagnostic. I know that for docs out there that are doing PRP injections, they're
Yep.
actually using it. If they don't have ultrasound, they're actually using this to find the spot, marking it, and they're injecting into that area.
That's so cool. Listen, you brought up pain, and I believe there's a difference in when the therapy is being applied in the sensation. I've had radial shockwave done before, and it hurts. It works,
Yes.
but it
Yes.
hurts. And there's a scientific reason why the focus doesn't have the intense pain response that the radial does.
Yes. So with how I what I said before about the radio, it's kind of like a grenade going off. So anytime you put a shockwave device on tissue,
Yeah,
especially on near bone, you're going to have that vibration off that bone, and you're going to cause a little bit of pain. With the focused, it's so precise that you know exactly where you're going, and you can stay away, and it's not gonna vibrate off that bone. So I can move it around and not worry about the pain as much. The older radials and even some of the newer radials, they're a lot more painful than the focused. And some of the radials, you have to apply some type of numbing cream to be able to do the treatment.
oh yeah,
Not
yeah,
really with a focused.
yep. And I believe that the sessions are shorter actually with focused.
And the sessions are shorter. We can the coolest thing about it is they feel the pain going away, and then that immediately when they get up from the table, especially when we do knees, Knees are highly avascular, and it seems to work so well on knees. I know a lot of docs that just have knee pain clinics that use
Yeah.
Shockwave.
There's a whole
And
huge billion
yes,
dollar market in knees.
yes, and I mean, and the coolest thing is immediately when the patient gets off the table, they are pain free. Now, it it will come back. The pain will come back over the next couple of days, and that's why we need to see them for multiple treatments. But they see it immediately work, and that's the best thing.
Gotcha. So we mentioned knees. What are some of the other cases that you see there in the practice and that docs might see in practice that the focus might give them additional um, uh, therapeutic window to work with?
So I see anything from golfers and tennis elbow, a lot of shoulders, a lot of, again, a lot of knees. Plantar fasciitis is huge.
Yeah,
There's a huge market for plantar fasciitis. And then you have the men and women's sexual health, which is a whole nother division, which
sure.
is really cool. Gainswave and FemiWave.
Yeah,
And so you have that, you have cellulite treatments, and you have neuropathy using it. I use a lot of it, a lot of neuropathy treatments. I use it on the feet, on the calves. We have other protocols that go along with that, but there's just so many things that you can use these
and
devices for.
I mean, even in healing and breaking up of scar tissues, right?
Yes. Yes. A lot of scar tissue. And the coolest thing, especially about with like the OmniWave, is you can set, if I want to go 1 millimeter, if I want to go deeper, I can set it to where it's more superficial so I can take care of scars if I don't want to have to go that deep. So you can really set to where you want to go.
That's amazing. Super cool. Yeah, you mentioned sexual health and wellness, ED. There's a bunch of our clinics who um, get into the sexual health and wellness area, and this is a tremendous asset for that,
Very much so.
without a doubt.
Yep.
So again, this unit does a little bit more, takes a little less time, hurts less, but it costs more.
Cost
And
more.
yeah, talk about that a little bit because I know price is, I'm sure, something that folks are thinking of when they think about adding a piece of equipment to their practice.
Yes, I mean, it's the strongest, fastest, purest form. It is a little bit more pricier than, but the coolest thing is the support that you get. So you will actually have somebody that will come out and train you on how to use the device. The marketing, they actually give you marketing. I believe it's 60 leads they give you through some type of through marketing. And they also give you, I believe it's a couple months of Gainswave for free with it.
Yeah,
So they're giving you ways to pay for the device. So that's the coolest thing.
sure. And if folks aren't familiar with Gainswave, Gainswave is a brand of shockwave therapy specifically for ED. But one of the things that we've learned is being associated with the brand. That the whole idea is to get your practice seen, heard above all of the other chatter that's out there, and being associated with a nationally recognized brand that's advertising in major publications is a big differentiating factor when folks are searching on Google for Shockwave near me.
Correct. Correct. 100% Mark. Yes,
Very
sir.
cool. So you're going to be with us at our Dallas event, and
Yes.
I know you'll have the units there, and I'm excited that we'll do some demos.
Yes.
Um, that's going to be fun.
Yes. We're really excited to come to Dallas. We'll be speaking and we'll be doing demos for anybody that wants to see the machine. So it'll be a lot of fun. I'm excited.
Awesome. Well, Jason, thanks for spending the time with us today. I appreciate it very, very much. I look forward to seeing you next week in Dallas. And for those of you who haven't had the opportunity to check out the new OmniWave device, come to Dallas and join us and learn more about it. Thanks, Jason.
Thank you. Appreciate it.
This is Dr. Mark Santa signing off. I hope you make today an exceptional day. Bye bye.